The presenting health professional has made every attempt to protect the privacy of patients whose cases are discussed, and we ask that you respect that privacy. Please limit the forwarding of this video to fellow health professionals only. In any discussion of specific cases presented here with a wider audience, please remove any reference to the presenting health professional or the forum. Thank you.
So welcome, everybody. It's very exciting to have you all here. I am Dr. Ted Barnett, President and founder of Rochester Lifestyle Medicine Institute, and I'd like to welcome you all to Lifestyle Medicine Grand Rounds. And tonight we have a wonderful case presented by Dr. Kim Scheuer called Lifestyle Medicine as an Adjunct to Psychiatric Care. First, I'm just going to tell you a little bit about our agenda for tonight. 5 minutes of introductions, then Dr. Scheuer will present her case, and we think we'll be done presenting the case around 8:15, and then we'll have about 15 minutes for Q&A, and then we end officially at 8:30, and usually there's lots of conversation going on even then. So what we're going to do is officially end at 8:30. So those of you who have to go can sign off. You will receive sometime later this evening, you'll receive an email that gives you a link to a survey. If you fill out the survey, you'll be emailed a certificate for 1 hour of CME, and then we'll have that optional in-lobby discussion. So if you're interested in learning more about what we do at Rochester Lifestyle Medicine Institute, we love to partner with doctors. We've had over 200 doctors around the country refer patients to our programs, and we're especially proud of our Jumpstart program, which we started ourselves, the 15-day whole food plant-based Jumpstart. If you look at the bottom of that slide, all 3 of those programs are ACLM certified, and we run all 3 of them for your patients. All of our courses, we run several CME programs, including the one you're attending right now. They're all made free because of a generous donation from a very generous donor. And you can get more information, again, at our website. So now on to the fun part. I get to introduce who's here tonight. So Dr. Kim Scheuer is presenting the case tonight. She's board certified in both family practice and lifestyle medicine. She started the online focus program Docs, Lifestyle Medicine, and also practices with plant-based telehealth. She's also conversant in Spanish and American Sign Language, which she uses to bring her knowledge to multiple communities. Dr. Milton Mills practices critical care medicine in the Washington, D.C. area and has served previously as Associate Director of Preventive Medicine and as a member of the National Advisory Board for Physicians Committee for Responsible Medicine. He has been a major contributor to position papers presented by PCRM to the United States Department of Agriculture regarding dietary guidelines for Americans. Dr. Mills has published several research journal articles dealing with racial bias in federal nutrition policy. He frequently donates his time practicing at free medical clinics and speaking at hospitals, churches, and community centers throughout the country. He was featured in attention-getting films What the Health and The Invisible Vegan. A major focus of Dr. Mills' patient advisement and lecturing is the use of nutritional measures to reduce the risk of major chronic diseases. We have Dr. Mira Agarwal and Dr. Carrie Graff as our regular panelists. So Dr. Agarwal is from Ann Arbor, Michigan, and she's board certified in internal medicine and lifestyle medicine. She graduated from the Royal College of Surgeons in Ireland in 1991. She completed her training at St. Joseph's Mercy Hospital in 1996. I'm assuming that's the one in Michigan. She has been involved in the development of the IHA Folletti Lifestyle Institute in Ann Arbor and implementing wellness programs for its physicians and staff. She has also developed an outpatient lifestyle medicine clinic for the internal medicine residents at St. Joseph's Mercy Hospital, where she is on the faculty. Dr. Carrie Graff is board certified in both family and lifestyle medicine. She serves as lead lifestyle medicine physician for Rochester Regional Health in Western New York and works to integrate lifestyle medicine throughout this large healthcare system. She is the co-author of 4-Leaf Guide to Vibrant Health, using the power of food to heal ourselves and our planet. These are Dr. Susan Friedman and I are here, regulars with Rochester Lifestyle Medicine Institute. Dr. Friedman is far more impressive than I am. She's board certified in geriatrics, internal medicine, and lifestyle medicine. She's professor of medicine at the University of Rochester School of Medicine and Dentistry and founding director of lifestyle medicine at Highland Hospital's Department of Medicine. She is RLMI's Director of Clinical Studies, a member of the American College of Lifestyle Medicine's Economic Research Consortium, and fellow of ACLM. And she's the author of more than 40 high-impact papers, which have been cited over 2,000 times. And that's me. I'm board certified in radiology, interventional radiology, and lifestyle medicine. And now it is time to turn things over to Dr. Scheuer, and I am going to stop sharing. And wow, look at all these great faces. I get to see everybody now. Dr. Scheuer, welcome. Dr. Mills, welcome. It's so great to have you.
Thank
Dr.
you so
Agarwal,
much.
yeah, Dr. Agarwal, Dr. Graff, thank you and welcome. Dr. Freeman, it's good to see you again. And look at all these people out here who I recognize. Oh, it's such a delight. Dr. Scheuer, please go ahead and start sharing. We'd love
Perfect.
to hear about this case.
Okay, let's see if I can do this.
All right.
Okay.
So far, so good. It says you're
Okay.
sharing. We like that.
Yay. Can everybody see this? I hope so.
Yeah.
Can you guys hear me?
And we can hear you
Hi.
and go for it.
Okay, great. Thank you. I'm going to present a case called Lifestyle Medicine as an adjunct to psychiatric care. And he's already introduced me, so let's keep going. OM is a 50-year-old female with a history of bipolar disorder, hypothyroidism, and obesity. She first saw me in February of 2002 with a complaint of a long list of problems I feel are associated with trileptal, which I've been taking for 13 years. Her goal was to decrease her trileptal and Zyprexa slowly under medical supervision over a year. She said, my psychiatrist doesn't believe diet can change chemistry. So again, the primary goal was to decrease the trileptal slowly, not get off of it, but go down slowly and adjust the Zyprexa. And her other goal was to lose weight. She had gained significant amount of weight on the medications. She had started herself on what she called a Furman type protocol, and also did, at the time, was starting to do Dr. Greger's Daily Dozen. Her vitals were as follows: BMI of 32.11. Blood pressure was unknown. She says it tends to be low. Her meds were trileptal 900 twice a day, with again the goal of getting down to 300 twice a day. Zyprexa 7.5 twice a day, goal of getting down to 10 once a day. Levothyroxine, and for some reason she was taking 4 baby aspirin twice a day. She had a bunch of supplements, which you can see here, quite a few. Some of them very reasonable, some of them were interesting. She had a family history, father's side of diabetes, heart disease, mother's side of high blood pressure. She lived with her mother and her son. She homeschooled her son until a recent divorce, had no alcohol, no smoking, had attended culinary school in the past. Her past medical history, bipolar. She had her first mental breakdown when she was 25 years ago when she was in grad school. She was hospitalized several times in the past, on multiple medications in the past, including Haldol, which had made her sleep for 9 months, as she said. She had a most recent breakdown, 11 of 2021, when she described as bad, with severe mania and depression, cycling through during stressful time during the divorce, to be honest, and when she took herself off her medications. The most recent breakdown lasted 2 months. Her psychiatrist put her on high dose of meds over 1.5 years prior, after another bad episode, and she had been weaning down since then, but then she took herself off her meds and her psychiatrist had put her back on the meds at very high dose. She had a past history of cholecystectomy, and I asked her for her labs, but she didn't have them at that point. Lifestyle focused information. Movement, when her meds are very high, or my meds are very high, I don't have any energy to do anything. And sometimes I feel lucky even to have enough energy to use a microwave and toaster, but she loved Qigong. The stress, the divorce was extremely hard on her. It was now final, and that's why she felt she could start working on weaning off her meds, because she felt like she was more stable. She uses meditation, breathing, yoga, and Qigong for stress reduction. For sleep, she usually takes melatonin to get 8 hours of sleep. Sometimes the amount necessary changes when the seasons change. She does snore and have trouble falling asleep. When her medications are high, though, she sleeps way too much, and at times was sleeping 14 to 20 hours a day with the increased medication. support. This is very important in my decision to help take care of her, was her mother. Her mother was at every visit and was very involved in her, in every aspect of her life. She felt isolated since being, due to the recent breakdown. Obviously, she was isolated with COVID, but she did feel less isolated then, but after the breakdown, she felt pretty bad. She said she's on a vegan processed food diet with Cheez-Its, which happen to not be vegan and are not food. They do have whey and skim milk. She did not know that. She used a lot of plant-based meats, vegan cheeses, and some non-vegan foods, drinks waters and juices. And, you know, later on, we found out there was some pizzas involved and stuff, despite her saying that she had started on a Furman type protocol and Dr. Greger's daily dozen. She does not drink or smoke, and no non-medically prescribed drugs other than the supplements, which we can consider possibly drugs. So just to remind people about the meds, Trileptal, and I can't pronounce some of these things, so I'm not going to try, is used for bipolar disorder. The average dosing is 600 to 1200 twice a day. She's had side effects, and some that she was experiencing currently and some she had in the past, including headaches of the Trileptal that she was experiencing: headaches, fatigue, tremor, cognitive dysfunction, impaired concentration, withdrawal symptoms, with abrupt stopping of the medicine. Just to remind you, she was currently on 900 twice a day. Her goal was to get down to 300, and that's lower than the average dosing, but she had been very stable on that in the past when she didn't stop taking her meds. And about the Zyprexa, which is another medicine for bipolar type 1, manic mixed bipolar disease. Average dosing is 5 to 20 milligrams a day. The effects that she is experiencing and has experienced in the past: weight gain, somnolence, increased appetite, extrapyramidal symptoms, and tremor. She was on currently 7.5 twice a day. Her goal was to get to 10 milligrams per day, with which she had been stable in the past. So my question of the panel is, what are your general thoughts? Do you believe that diet can change chemistry? What about her thoughts on getting down off her meds, and would you change any of her supplements? And what lifestyle medicine pillars might help?
Wow. So we are off to a great start. Dr. Mills, I don't feel like you have to answer all those questions, but would you like to take a crack at any of them?
Well, so for starters, my general thoughts are, there's no question that diet can change chemistry. And one of the things that is really key has to do with our colon, because the colon is really a underappreciated organ in terms of its influence on our total body chemistry and on mood and behavior. And in fact, it really impacts every physiological system in our bodies. And that's through a variety of different mechanisms. One is its impact on total body inflammation, because as we all know, it is the place where our microbiome is housed, and how healthy our microbiome is depends on what we're feeding it. And if we are not getting either enough fiber or the right kind of fiber, we cannot have a healthy microbiome, and we end up with what's referred to as dysbiosis, the wrong kind of bacteria that are not producing the right kinds of short-chain fatty acids and other physiologically active compounds that can improve and stabilize mood, that can decrease inflammation, which can drive many of and exacerbate many disorders like anxiety, bipolar disorder, depression, and so forth. And given what she had been eating, there's no question that she was almost certainly absorbing a lot of toxic byproducts from this diet that were likely exacerbating some of the mood and behavioral problems that she had been experiencing. I would absolutely have done what I think the doctor did, and that was to continue to encourage her to switch to a more whole food, plant-based diet that was made up of actual healthy whole plant foods, so she could get the kinds of complex plant fibers that would allow her to build up a healthy microbiome to really start to decrease inflammation and provide her body with the compounds that would help reverse some of these problems that she was having.
That's great. Thank you, Dr. Mills. So actually, in the interest of time, what I'm going to do is let Dr. Agarwal pick another one of the questions that Dr. Scheuer has posed. Which one would you like to answer, Dr. Agarwal?
Okay. So I'll kind of just mention my general thoughts and touch on her supplements, I guess.
Okay.
So I was very overwhelmed when I saw this case. It's a tough one to deal with, not just mental health, but bipolar disease, where you can have such swings. And just like Dr. Mills said, we know that there's such a tremendous impact with foods, processed foods. And it's kind of a vicious cycle, right? Because the processed foods themselves are addicting. And then to try to have behavior change to then get them away from it, to have an improvement, they're going to have to go through a withdrawal of that before they even start to see a difference. And that can be anxiety provoking. So it takes a lot of steps, a lot of moving parts. I always find the whole list of supplements very, very interesting, because people, like, especially in this country, just kind of pluck them off the shelves based on, oh, this is good for my brain, and this is good for my back, and this is good for my neck and my, my hair and my skin. And these are all very, very active ingredients. And in other parts of the world, they're actually prescribed by, practitioners who know what they all do and how they interact. And the one that obviously leaped out to me was ashwagandha, which is one of the oldest Ayurvedic medications. And actually, that was a good choice for her, because it actually has been shown to help with anxiety and stress, and it causes some neuromodulation also. But I have no idea how it interacts with her current medications. So, or even just her health overall. So my overall impression at this stage is, wow, Kim, you took on a lot, because, you've got to get everybody under the same roof on the same page. You're dealing with someone who's had a very brittle past, and we've got to not only wean her off of her meds, clean up her supplements, but also walk her through a phase of withdrawal as you try to eliminate the processed foods before you even bring in like the good food, or you can do it together. So that's like my thought on it right now.
Wow. That's great. Thank you so much, Dr. Agarwal. Dr. Graff.
Yeah, I'm going to talk about general thoughts and then getting down on medications. So the good news is she's not saying that she wants to get off of her medications, right? Because I think we're pretty comfortable with the fact that this patient's going to need some medications. We're probably not going to be able to make this big change solely on lifestyle modifications. There is some genetic component here that's significant, and it would be really unlikely that we're going to be able to get her off all of her meds. So I felt good that wasn't her goal, but it was also really interesting because she was saying that she had very specific goals to get in mind with where she wanted her medications to be. And I have patients that come in for heart disease or diabetes, and their goal is to get off of all their stuff. And the reality is what you really want is the most functional life you can get, right? How can you feel the best? How can you function at your best? And that might involve a different level of medications than what her goal is. It might have been that she had been stable on those at one period of time, but then when she hits a crisis, she's not stable on those. So they may not be enough when the times get tough. So I would work with kind of reframing that general thought from like specific goals to get to her meds, and versus the overall goal of functioning at your best and having enough medication on on board so that when you do have a crisis situation, it doesn't throw you off kilter. A second thought that I had about this was that she has a history already of kind of doing what she wants with her meds, like she's changed doses and she's stopped them for periods of time. And I would not consider working with this patient to try to work on reducing medications unless I contracted with her that she would not make any other changes besides what you are doing here. If she thinks she wants to make a different change, she needs to talk to you first. The other reason for that, in addition to her safety and it not being a complete hot mess while you're doing it, is that her psychiatrist might decide to stop working with her as well. If she's kind of going rogue working with you, her psychiatrist might say, well, you're not seeing me for this, I'm not responsible for you anymore. So I probably would not have done anything here without kind of talking to the psychiatrist. And since I'm kind of mucking around with the medicines that they're kind of managing, just to be on the safe side with that. And yeah, those were the main thoughts I had, was just making sure that she contracts and she doesn't change things around, that her mom is going to continue to be on board, focusing on the overall health and also involving the psychiatrist.
Great, thank you for that, Dr. Graf. Dr. Scheuer, how did they do?
Okay, well, those are great thoughts, and thank you, everyone. Let's see if I can get the next thing going. Okay, so there are studies that it's supporting lifestyle medicine, bipolar, and in psychiatric disorders are limited, but promising. So, you know, there are studies that show that the role of diet in bipolar disorder, when they consume an unhealthy diet, does do exactly like what Dr. Mills said, which was, you know, deal with inflammatory processes, deals with the gut microbiome, et cetera. Same thing, you know, that physical activity, well-being, and all that will help. So I felt comfortable adding the lifestyle components, especially working on diet, sleep, and exercise. But it is interesting. What I did at my first visit was discuss the fact that she needed to get off of the processed foods, which affect the inflammation and gut microbiome and the brain chemistry, to promise to increase her movement daily, to work on her sleep. But there was no way I was going to work with her without her mother's 100% buy-in as we adjusted meds every visit and every time. And I wanted constant supervision. And she agreed to that. Her mother agreed to that. I did suggest she start the Rochester Lifestyle Medicine Institute 15-day jumpstart, which she didn't do, unfortunately. But I said if she wouldn't do that, that she start, you know, a very high anti-inflammatory smoothie at least once a day, that she send me her records, let me talk to her psychiatrist. And if she adjusted her diet and worked well on all of the above, we would consider decreasing her trileptal at the next visit. I did get her permission to talk to her psychiatrist, but never got response from the psychiatrist. It was interesting. 2 weeks later, she said she was doing the daily dozen and working Furman. She was having a smoothie a day, which was a good addition. She really had only in the last 2 weeks had 3 bites of cheesecake, a couple of wheat thins, and some fried jalapenos, which is much less than her first time. And the problems she was having was she was sleeping all the time. She was not moving throughout the day because she was sleeping up to 18 hours a day. And when she was awake, she was eating. There was some changes. There was some discussion about really what her weight was, but and what she had said the first time. I agreed to decrease her meds a tiny bit because her mom was on board with this. And every time I made any change, I made sure that her mom had a lot of say what's happening because she had been living with her mom for years and she was very aware of her moods. Because we were changing meds, I wanted to see her frequently and she was going to send me a food, mood, sleep diary, and movement diary twice a week for accountability. Then this worked actually quite well, and she stabilized quite well. She weaned herself down we weaned her down to on the trileptal and the Zyprexa. She did have to go up on her Synthroid a little bit because when she was seeing a regular doctor and getting checked for that, the labs indicated she needed to go up. She'd been stable. Well, she'd gotten off most of her supplements and was just taking the vitamin D, B12, turmeric, AMLA, and omega-3s at that time. Now she, after, this continued time, she was sleeping a solid 7.5 hours a night with good sleep quality. Her food was better. She was eating much better overall, much more greens and fruits. And interestingly enough, she had talked to me about her son having ADHD at school and that he was a picky eater and he was drinking Ensure every day. And I suggested maybe switch to Kate Farms. I actually suggested a whole food plant-based diet for him, but that was not going to happen for her teenage son. But she switched him to Kate Farms and he was doing better significantly because that was a plant-based option instead. She was moving more. She had gone from less than 1,000 steps a day to over 10,000. Her weight hadn't changed significantly. She had been down for a while, but then her son started school again and she was having some issues with some stress. And she had plans to take a raw vegan cooking class in January to help feed her family. And we were seeing each other once a month rather than every 2 weeks. And she had been seeing me regularly for, as we were getting her stable and every 2 weeks. And I was not going to go down at all on her meds until she had lost more weight and she continued to remain more stable. Then I saw her January 5th, and she stated that both her son and her had a bad virus at the end of December. And she asked me if I could see her within a week, which I thought was very interesting. She stated that she was on her meds, but she was having a hard time sleeping and staying on track. And she didn't tell me everything. And her mother didn't tell me everything. I saw her a week later and we got from her that she was eating cheese pizza because her mom was now bringing pizza home for her son, and that she was sleeping again and not exercising. And she didn't admit at first that she wasn't taking her meds, but she then, after I, said, this is not right, what's going on? She said she'd stopped her thyroid meds and she'd stopped her Zyprexa. And she had decreased her Zyprexa on her own, and she wasn't sure how much she was taking of her trileptal because she was forgetting things. Her mother said she'd been crying all week and she was not very communicative. So that was an issue. And what would you guys do at this point for the...
Yeah, thanks for that. So I'm going to turn to our intensivist, Dr. Mills. What are your thoughts at this point?
Well, first of all, I just want to say, Doc, that I cannot stress enough how much I affirm you for your willingness to hang in there with this patient and your perseverance and your just commitment to this patient. I mean, it's just it's really inspirational. But one of the things that's just really interesting to me was that this is, in my opinion, it's very clear that this patient was clinically hypothyroid from the symptoms with the mental slowness, the crying, the clear signs of depression. But one of the things that's also very interesting was that there's a study, and the study was done in lab animals, but it showed that when these animals were fed large amounts of animal, that was done in rodents, but when they were fed large amounts of animal protein, that these protein residues were delivered to their colons, where they were acted on by bacteria that essentially rotted these animal protein residues into toxic compounds like cresol and others that were then absorbed and went into the central nervous system and interfered with the differentiation and function of oligodendrocytes, which are responsible for myelinization of the neurons in the central nervous system. And that resulted in behavioral changes consistent with anxiety, depression, and so forth. And so the changes that you saw in your patient, I think could also be reflective of, this change in her behavior of eating more pizza, more dairy, and more of these just toxic animal foods. And so I think, her not falling off of her synthroid and switching to this more animal food-based diet were highly likely to be responsible for a lot of what you were saying, and that it was just really important to do what, since I saw your other slides, I know you did, that was to really, really push her towards getting back onto a whole food plant-based diet, and I'll stop there.
That's great. Thanks, Dr. Mills. So we're kind of running out of time, but let's hear quickly from Dr. Graff and Dr. Agarwal.
Yeah,
Go
we
ahead,
just make sure we restart the meds as as she was supposed to be taking them as soon as possible. I don't know whether the endocrinologist had wanted to increase her because she had her thyroid done during a period of time when she was off her meds. So I don't really know what the right dose was for that. But it's funny because she had always kind of used the Zyprexa as being the reason why she's feeling so fatigued, but here she is completely off of it and she's dragging like crazy. So it makes you wonder how much the thyroid was affecting things otherwise. And then, if she does need this increased dose of thyroid, was it the increase in animal proteins that she's sneaking back in, especially dairy, since that's a huge trigger for autoimmune disease getting worse. So there are lots of folks that we've got on thyroid medications that you're able to wean off of once they get off the dairy. You do it slowly when you're doing it, but I just wonder if that's kind of, I wonder if she was sneaking in some dairy in the beginning too, as her thyroid was getting worse and they were upping her dose and we don't really know about it.
Interesting.
Yeah,
Thanks
kind
for
of
that.
being completely forthcoming has not been, that makes it really, really hard to work with, right? Especially when the symptoms are so confusing. One of the other things that came up earlier was that, she was pretty fatigued when she first saw you. And then you had asked her to do the 15-day jumpstart or to do, the green smoothies really aren't that hard, right? You throw it on a blender and okay, but the 15-day jumpstart is really tough. I would not, for somebody who's really fatigued and doesn't have a lot of energy and is sleeping all day, I think I would have gotten, like, if she were here in Rochester, I'd have her order sweet pea whole food plant-based, right? So she gets basically food delivered to her that she doesn't have to cook, that she can just eat for a period of time, and then slowly work out and adopt kind of, let's instead of ordering the breakfast, let's have you do oatmeal and fruits. Instead of ordering the lunches, let's have you do a big pot of soup on the weekend. She's got more energy. But I think that was a big ask in the beginning to have her do that program. And I think what she did was probably more reasonable, but using some of those services, you could use Daily Harvest and have it delivered to her door frozen that she could just heat up, making it easy. So people, it's tough to get up the energy to do those things right at the get-go until they're feeling better. Once they're feeling better, they can.
Interesting. I'm gonna interrupt you, Carrie, Dr. Graff, and because we're gonna run out of time. So Dr. Agarwal, any thoughts?
Just very briefly, I concur with everything that was said. The only other thing that I keep wondering is, like, how independent is this woman and how capable is she of making these choices? And you said at the very beginning that her mother was so vested, yet you just told us that the mother was bringing in pizza for the son. So, you have to wonder, like, now I'm sitting here wondering, okay, bipolar disease is somewhat genetic. So how much is the mother like, and I think overall she probably is reliable, but at the same time, until the entire household is committed, you're always going to have breakdown, right? I mean, you're always going to have some kind of, it's already hard enough without having temptation thrown into there. So, everything is so compounded. I get the impression this woman is very confused and doesn't really know what she's doing and isn't able to make her own choices. So you've got to totally I think you sat the mom down, right? And you've got to really get her back on board again.
Yeah.
Ted, can I make one last quick comment?
Sure.
And that was about
Go
the
ahead.
teenage son. I started taking care of my nephews when they were 14 and came to live with me, and they both announced at different times that they were not vegan and they ate meat. And I told them both that I didn't buy poison, and they didn't have jobs, so they were going to be vegan. And I feel like, you know what? Parents' responsibility is to do what's best for kids and not to give them what they want. Because if they came home and said, hey, I want to smoke crack, we wouldn't buy it for them. So why would you buy something that's not healthy? That's just my opinion. Let's move on.
I 100% agree. And so I did talk to her mom. I said, you cannot bring this in. And it's interesting the child dynamic in there too, because he runs the household too. So what he goes. But got mom to agree that the mom would give the patient, and the patient to agree that mom would give them her meds every day. And that we would not at all, we would put her back on the regular meds she was supposed to be taking regularly, see what happened, get her back on her thyroid meds immediately, restart the smoothies, no processed foods, no cheese, and I would see them in 3 days. But also was like, she needs to go to the ER or the psychiatrist if she is worse. And I worried. And then 3 days later, she was doing so much better. Now she was moving and cleaning, but now you could have a conversation with her. And before that wasn't possible, hoping that she'd be back. Since she was doing so much better, we decided to keep her on her current meds, but made it very clear with mom that she should go up to 5 milligrams of Zyprexa a night if she wasn't sleeping well. Asked her now that she was moving more to start Qigong again and keep her on her smoothies. And, again, do the same things, and then a very quick follow-up again. We continued 7 to 10 days apart for the next several weeks, and she became much more stable. She was much more functional, cooking now foods for the family. Unfortunately, her mother and son wouldn't eat them. Her weight was down again significantly. So that made me think she was actually doing what she was saying. She was doing Qigong every day. She was doing other meditation, and they were even discussing getting her a part-time job at a vegan restaurant. But at the same time, the mother was very frustrated because she was still having some cycling, like on Valentine's Day, which was the anniversary with her and her ex, there was a lot of crying, and mom was concerned about her future because she's in her 80s, can't continue to work, cook for her grandson and herself, take care of her daughter, take care of her grandson, and was kind of at her wit's end. So there's tons of questions, which we'll probably have to do later, but helping somebody with control weight when they're on medications that do cause weight gain, suggestions for the social issues in this case, because you have an elderly mother, a teenage son who has his own issues, and part of it to do with the family dynamics. Patient needs ongoing support when my visits are not covered by insurance. They did submit some, and we would get a little bit of it. And so those were some of the issues I had in the case. And I'd love to get a little bit of response from that. But I also have another quick case I want to present, so I'm not sure which way to go.
Why don't you go with your other case real quickly, and then we'll.
So
then
this is another case.
Okay.
This is another case of a patient with bipolar disorder, lifelong, had type 1 diabetes, who was on multiple meds, multiple supplements when he first saw me, who wanted to decrease his meds. We talked about lifestyle interventions, changed from a standard American diet to a very strict, very low fat, whole food, plant-based diet, got him to move and walk every day. He started doing vigorous yard work outside. We told him to give up alcohol, work on his sleep, and work on stress reduction. And he had his wife on the journey, who was very involved with his care. And over the next 10 months, he lost 25 pounds, reached his goal weight. His mood improved significantly per the wife and the patient. They stabilized after years of going up and down. Energy improved significantly, saved significant amount of money by weaning him off many meds. His GERD resolved, his diabetic neuropathy resolved, his A1C went from 8 to 6.7. He'd never been below 7 in his life before. Time in range was above 90%. His lipids improved significantly despite weaning down on his statins. His thyroid remains normal despite decreasing his synthroid. He'd been on multiple meds, and of the meds that he started on, he was able to get off it. Metformin, Zetia, Dexilent, I can't say it. A medicine for bipolar, Seroquel, another medicine for bipolar, and off of many supplements, still, throughout this whole thing. And we weaned down his rosuvastatin from 20 to 5 with this low cholesterol, and his lisinopril got weaned down. He wants to get off, but we talked about whether he needs to stay on it because of his diabetes. So lifestyle medicine works. It helps, especially with motivated patients, but with support. You can't do this alone. So these are quite different cases with different degrees, but both patients were able to improve their lives when they were doing the lifestyle interventions. The first one with some issues. So I'm going to stop sharing and see.
That was fantastic. Thank you, Dr. Scheuer. Brilliant, brilliant. I'm going to see if we have any comments from our panelists, and then I understand there's some people in the audience who would like to contribute a little bit. So, Dr. Mills, do you have any more thoughts?
Just that the first patient was and is clearly a very difficult case. I would look to see if there are any support groups in the area, plant-based support groups that maybe she could get tied into, who could help give her, social support. I think I'm sorry, I don't remember the other doctor's suggestion about food delivery services that could help deliver vegan food, so that getting delicious, healthy, well-prepared food is not such a problem, and that would make adhering to a good, healthy, plant-based diet easier, provided that it's affordable, and to just really stress the importance of adherence, and hopefully she will continue to improve.
So I would just like to say, I totally agree. And I almost wonder whether the mother might need to be contracted with like a SMART goal, like, can we try this for 30 days, where you will be on board. And if you want to truly do this for your daughter, how about you try being plant-based for 30 days? Because as long as we were like having this dichotomy of, well, I really want to do this for her, but I'm not going to do this, you're sending mixed messages. And she's doing the same thing that, like our children watch what we do, not what we say. So that was always going to be a problem. I think with the bipolar issue, she definitely needs social support. And there are some fantastic foundations out there. There's the Brain and Behavior Research Foundation, where they help people with bipolar disease, because you need to reach out to people in the community who really, really understand. I don't think this is something that any of us can do alone, right? Like lifestyle medicine truly believes in that multidisciplinary approach, and you really, really have to focus on that. And then the last piece, because I know there's so many other points of discussion that I felt was not mentioned, which I think is such a critical piece for mental health in our world these days, is social media. And I think that should have been something that should have been addressed as well. One of the things that I have come across, I love this term and I use it now a lot, especially with my young adults and my young patients, is digital fasting, because they all have heard of intermittent fasting, but it's a great way to sort of say, because, their minds are just like swirling, like they're scrolling forever. And there's so much data to show us that this so negatively impacts their brain waves and their ability to sleep. And you're working so hard at all of these things. And just like the SMART goal with, plant-based, get rid of processed foods, we have to also give them a focused time where you make them realize, no, like just glancing back and forth intermittently is also not switching it off, right? So I have for quite some time now offered them digital fasting. Like, how about that? And then I kind of discuss, how long do you think you can do this for? Can you do this for 1 hour a day where you put it away? And it makes them so much more aware of it. And I think that it would help you bring her to her goal.
I love that suggestion. One of the things that I was thinking about during this is that, she's on 2 meds that both cause weight gain. I would love to know if they've ever tried her on Topamax, which can also be used as a mood stabilizer, and it helps for weight loss. And especially if you might still need to use one of the other meds along with it that would cause weight gain, but it would offset some of that effects. But she might have been tried on and it didn't work, or so you don't really know because you never got a hold of the psychiatrist, which is really frustrating. So one of the other things with that kind of insatiable hunger that people get, if they're eating a lot of food and it is lighter on the calorie density scale, it's going to have less of an impact on their weight. So I would think about it as kind of like eating more. So I like the fact that that she was looking at Gregor's Daily Dozen, because it's really about eating more rather than excluding certain things, and that might help to get her to fill up more on some of the other foods that are less calorie dense, that might help.
Can I just interject there? I just wanted to suggest and throw out, for in case people don't know, fennel, which is used a lot in like after Indian food. It's always available at restaurants and everything. Helps digestion, and it's a fantastic appetite suppressant. So, you can eat it, you just chew a tiny like teaspoonful of it, or you can actually make it into a tea. You can boil it and sip on it. And it's amazing how well it works to suppress your appetite. It's completely natural. It's healthy. It helps your gut and all of that. So
Very cool. I had no idea. Thanks.
Great.
You said fennel?
Fennel. Yep.
So fennel seeds, right?
Yes. Fennel seeds.
Right. Interesting. Well, that's
One of
great.
the other thoughts that I had on this case was for this daughter. I mean, the mom is in her 80s. This daughter is going to need help for the rest of her life, because if she's not staying on her meds, she's just at risk. So she should have a case manager that could also help, in terms of what kind of housing and social supports would be there. If something suddenly happens and the mother dies, or the grandmother, right, or the mother of the patient, or she's in the hospital for a couple of weeks or whatever, there needs to be a backup plan. And that needs to happen now and not after you have a crisis.
And we've been working on that for sure. I've been trying to get her to be, consider being on disability, to get some extra help financially for the mom. I've considered, there's been so many things that we've talked about, but I love that, and I'll keep trying, because that became very clear with the mom that this is not sustainable, and she needs.
And it may be one of the cases where the psychiatrist can be helpful too, to help get her into where services, because you're probably not even in the same area, and could help with what services are available in her area. That I would definitely be calling in a lot of support there. I was a little confused on the second case. You said it was a type 1 diabetes, but then they're on metformin. So is it
I thought that was really interesting too.
I wonder if this is a type 1.5 where they're insulin dependent, so they're calling it that.
No, he's been type 1 since he was 13 years old, was on 50 units. That's what the endocrinologist put them on. Was on 50 units basically a day, and now is down to about 23 units and off the metformin. And just shocked that he had never been told that he should go plant-based, and shocked at how much his wife is an absolutely amazing cook, is 100% involved. And as somebody said, he probably did have insulin resistance before and now doesn't. So maybe the metformin will help at that point. But it was a very interesting situation where we were able to get him off of a lot of things that I thought were, extra and not necessarily needed.
And
metformin,
at the end, he was off of all of his psych meds, right?
Yes.
Was he on anything at the end?
Not for psych.
Hmm.
And he had been very stable for 8 months now.
Yeah, boy, that's really scary to have a lifelong bipolar patient.
Well, the question is that really a true thing? I mean, he's ADHD and all that, and his wife says he is so much more stable, and they're retired and live part-time together. I mean, live full-time together, and they're with each other 100% of the time. So it is really interesting.
Um,
Hopefully, if it does come back, that she'll see if there's an issue, but if
Sure.
it's concerning to have him on nothing, I would be really, really nervous about doing that, but great for him. I'm glad. And I'm sorry,
Yeah.
Dr. Mills, to be
I
nervous.
was going to say, metformin works by decreasing glucose production by the liver. And when you eat enough fiber and it's broken down to propionate, propionate does the exact same thing by decreasing glucose production in the liver. It also inhibits HMA-CoA reductase, which is the same target enzyme for statin drugs. And again, when you really begin to appreciate the potency and power of the colon for impacting brain chemistry, it really doesn't surprise me, nor does it really worry me that his mood is stabilized and that it will be consistent off his meds. I'm telling you, we do not understand the power of our colon and our microbiome, honestly. It's amazing. Wow. It's like we're drugging ourselves unnecessarily.
Thank you for that. So, well, Dr. Scheuer, you did an amazing job. I didn't think you could do it.
Right.
I knew you could take care of the patients, but I didn't think you could get through both of these cases the way you did. It was brilliant. And actually, we have time to call, if there's anybody in the audience who wants to make comments. I know there's at least one psychiatrist out there. So if you would like to make any comments, feel free, or if anybody just wants to raise their hand, be happy to hear from if somebody has any questions for the panelists, comments. I know these people are not shy. They just don't.
So there's one question about omega-3 fatty acids, which has some evidence of bipolar. So I definitely kept this person on omega-3s. And
okay.
And the other question that, I love some of the ideas about the Tobamax and Lamictal. She had been tried on all kinds of meds in the past.
Let me ask you a question. What was the question about omega-3s? What was the nature of that question?
The question was, what are your thoughts on omega-3 fatty acids, which have some evidence around bipolar?
So that was just the question?
That was the question.
Oh, okay. Because Ted, I sent you
Sure.
the papers on there is at least some suggestion that humans should get their omega-3s primarily as 18 carbon omega-3s and allow the body to go through the elongation process, because the intermediate forms are bioactive in us, and we should not take preformed EPA DHA because that short circuits our body's elongation process, and we end up missing out on important intermediates. And I think that that can have and likely does have an impact on mood and behavior issues.
No, I think
Dr.
that's really
Mills,
fascinating.
isn't there a small percentage of people who can't convert?
I'm gonna say I don't know that that's true. I think it's more of an issue with when people have too much omega-6, they saturate the desaturate enzyme that is common to both pathways, and they sort of overwhelm it and stop the elongation process in its tracks. And that is a problem with people eating just too much fat in general and too much omega-6 fats in their diet. And that's a common problem in Western diets.
That's great. You know what I'm going to do? I'm going to actually share my screen now and give the closing remarks, and then we'll be able to carry the conversation on after that, if that's okay with everybody.
Sure.
So another shameless plug for our programs here. These are all ACLM accredited programs that we run, including the 15-day whole food plant-based jumpstart that Dr. Scheuer alluded to. So we're very excited about being able to offer those. By the way, we are a nonprofit, so this is not really a commercial. Let me get to the next slide. And then you can always follow us at these various places at Rock Life Med. That's the YouTube channel, LinkedIn, Twitter, Facebook, and whatever that thing is, Instagram, I guess. So yeah, anyway, I'm so glad everyone was able to stick around for this. we're going to officially dismiss everybody at 8:30, like I said, and we'll look in your email for look in your email in your inbox for an email that will give you instructions for how to receive your 1 hour of CME credit. And I'm now officially going to declare that we are in the lobby now, and so that if you've stuck around this long, you've qualified for a CME, and I'm going to open this up to everybody. So where are we with that? Does anybody in the audience want to unmute themselves and say hello? So I know Dr. Friedman has all kinds of thoughts about this case. I can tell by her expression. So what do you think? And you're muted.
I really have nothing to add to this spectacular discussion. There was a question about whether this patient would be a good candidate for the LIFT project.
Okay, so yeah, so the LIFT program is another program that we run. It's not as intense as Dr. Graff was right that the 15-day whole food plant-based jumpstart is quite intense. It meets basically 7 times over 18 days, and we ask people to make lots of big changes. But the LIFT program was designed by Dr. Darren Morton in Australia, based on positive psychology, and it meets once a week, and it's kind of more of a little group support program. It does have a different topic every week. It goes on for 10 weeks, and there's homework assignments, and it's just a really lovely program for people who are having a hard time coping and just need to have that lift. And food is discussed at pretty much every one of the sessions. So, and we do advocate a whole food plant-based diet in that program, but each of the weeks is actually dedicated to a different topic. So sleep, exercise, relationships, and really that would actually, Dr. Scheuer, that would be, I think, a really great program for your patient. For one thing, it goes on for a long time, and we have a lot of people who do it again. They just because they like the support. So I think that would be great.
She's also a bit isolated, so it would help with the community aspect.
Right, exactly. She's isolated. Yeah, right. But Dr. Scheuer, I had the same thought about whether she needed a social worker. I mean, somebody needs to be checking on her, right?
Yeah, I think, and I've talked to them about getting adult protective services involved, because, to get them into the system for social work, not to say that anybody in the family is abusive or anything like that, but just to get them connected. And there's a lot of codependency and a lot of enabling of the son, who has a lot of control over me. And I mean, because in the beginning, the mom was actually plant-based, and they started that together. And that changed the whole dynamic. And then there are things that are the stressful things that happen, and there were things that I was just like, you can't do that. You are the parents. You are you are the adults in the household. You have to take control of this, and that's a really difficult thing. So I do think getting a social services in and is a huge thing. Yeah.
I'm hesitant to ask this question. I want to ask, where do they live? But I'm also sensitive to not asking too much PII, personal identifying information. And the reason I wanted to ask that question was to, with the idea of, are there vegan support groups in the area? And the reason is because, as a physician, I'm always a little leery of getting groups like Adult Protective Services or those kinds of groups involved, because they tend to have a certain mindset. You know what I mean? And they kind of come in looking for abuse and mistreatment, and we need to correct, or we need to step in and pull people out. And they also tend to not understand kind of plant-based mindsets. And I'm just wondering if maybe there were strong plant-based groups in the area, there might be people who would be willing to work with them to kind of be more of a support and you know, help them with, you know, attending potlucks and learning how to be vegan. I mean, you know, I have this idea that I would like to start what I call vegan action teams, where, you know, you have like a vegan chef, a life coach, a nutritionist that could go around and literally help people learn how to be vegan, because it's not as easy as it sounds, and it's not as straightforward as it sounds. But I think with a little coaching and a little support, people could make this transition much more easily. And you know, a lot of people, I mean, there's some people who can do it online. There's some people who can do it with minimal support. There are other people who need a lot more support. And they're not, and that doesn't mean they're bad people. That doesn't mean they're lazy. That doesn't mean they don't care. It just means they need more support. And so, you know, I think we have to look for resources in the area that could potentially help support them. And definitely before we call, you know, protective services, because they tend to be overworked, understaffed, and so they tend to be very, very concrete in their thinking and in their methods. And so I just want to be careful before we call them in, because they can be difficult.
Yeah,
I
think
will
that's-
definitely not
that's-
get them involved. I appreciate that input.
Yeah.
No, so she has, I thought it was great that they were thinking of having her work at a local vegan restaurant.
Yeah.
That was great, because I thought that that would be perfect. I haven't seen the family since that, because that was just recently, and hopefully that will happen. It's getting, yeah, I'm really pushing that, but I do think that they need a case manager of some kind, a local case manager.
If you
Really
have a
interesting.
big enough vegan community to have a vegan restaurant, there's a lot of resources in the community. She just doesn't know what they are yet, right? Because you can't keep running a
You can't
restaurant, a
support a
vegan
restaurant,
restaurant,
right.
unless you've got a
Right.
fair number of people who are going to be showing up and eating there. That means you've got a decent sized vegan community around. So
That's a good
on the other
point.
hand, they might be pushing all kinds of vegan junk food. So, you know, there's that side of it too.
So the other approach that I take with that, because food is such a social part of our lives, right? That's just, and so just like everybody is commenting, like they need a group, they need a community to do this. Sometimes the way I approach it is to, you know, it's kind of like that whole phone a friend thing, where you start with your innermost circle. And it's the same thing that you do when you're trying to quit smoking, right? And you tell your friends and you ask them to do this with you. And so what I've done in my own personal life, in fact, as well, with phenomenal results, as well as what I advise my patients is, hey, if you're going to go and you want to be with your friends, why don't you ask them, hey, will you help me? I'm trying to get healthier. Will you do this with me for a little while? Or just while I'm around, can we just have plant-based meals? Like you guys can do your own thing when I'm not around, but when I'm around, and then that way they don't feel isolated and they feel that they have support and they're not reaching out to strangers initially. Like as much as you can have like a vegan community, like we have a plant-based, you know, nutrition support group in our area, which is huge and really, really robust. But people want their own friends. They want their own community. And I think you can have good success even with a couple of people, like your closest friends, siblings, you know, whoever you might hang out with, and they'll say, okay, I'll try this with you. And then that's at least a start. And then they don't feel isolated and they're more willing to do it.
That's a great thought. I'm going to interrupt for just a second because we have someone who's got their hand up. I'm going to make a shameless plug first. Dr. Scheuer, you know, we do have a coaching service now. If you have a patient who needs, or that goes for anybody, who needs to check in once or twice a week with one of our coaches, we'd be happy to help set that up. And I know they don't charge as much as you do. So
Great idea.
here. Anyway, Joanne Evans, I'd love to hear what you have to say.
Yeah, thanks, Ed. It's a great presentation. I really enjoyed it. My background is a psych nurse practitioner, and I've worked with protective services. So thank you very much for not getting them into that protective service environment. It's not something you want to do moving forward. I would do some more wraparound services and see them as a family, and to get them, do a written agreement with them as a family, so you're really sure who's on board, and including the child. So include everybody. And then also I would have them work with another family, so they've got more wraparound support from another family, and get each of them some individual support from another family. I think all the recommendations have been really good and helpful, but I would give them some more wraparound support.
Great.
How do you set somebody up? How do you set two families together? How does that work?
Well, it sounds like there's a really big vegan community. So maybe get a grandmother, get another adult patient. NAMI is a great support for patients for psychiatric, and see if there's some patients in NAMI who were plant-based and who were part of that organization. What is
NAMI?
The National Alliance of Mental Illness.
Okay.
And also get the boy involved in doing some of the shopping and getting some of the groceries. And I'd like to get kids really much more involved in doing the menu planning. And just having them much more involved.
Nice. That's a great suggestion. Thank you for that.
Okay.
Yeah, absolutely. Anybody else in the audience? All right. Well, Dr. Scheuer, any final thoughts from you and the panelists?
No, I am so excited to talk to you guys. And she knows, I obviously asked if I could present her case because she's wants to get better. And so I was she was excited to share all of this information with her. So thank you, everyone. What incredible panelists and all the questions from the audience. Thank you.
Absolutely.
You did a fabulous job, Kim.
Yeah.
Well, please
Both with the
let her
patient
know
and
that.
tonight.
Please let her know that we really affirm her efforts and encourage her, and are quite proud of the progress that she's made.
Thank you.
Yeah, those are wonderful
Great
sentiments.
case.
Yeah. Dr. Agrawal, do you have any final thoughts?
I just think this is a really, really great case. One of the little tips, and you may have done this already, but I teach the residents, I give them a little lecture on behavior change, and there's these seven things that, you're supposed to do. And a lot of it is about managing your own state and reading the room and all of that. But one of the very, very powerful things that I really think works so well, in this dynamic, is when you tell the family member. So suppose, she's had all these ups and downs and the mom is working with you and everything. So you kind of take the mother aside and say, hey, I really, really believe in your daughter. She is going to do this. She's awesome. She's working so hard, even when she's down. And it's kind of like that little gossip thing, because that good positive affirmation comes right back. And then suddenly the mom is like, wow, this doctor really, really believes in her. And then the child, the patient is like, oh my gosh, I thought I had, how they come in and they're like, oh, I was bad today. And, you're going to scold me. And then that patient is so positively affirmed that they heard not directly from you, but from the parent who's also frustrated, that you are so proud of them and that you believe that they will make it. And it's just another way of having that whole group kind of cohesively get together. And it's just a positive affirmation, which I think works incredibly well, because you've got so many dynamics inside the room, outside the room. That they're not on their best behavior when they're not with you, right? And so it's going to kind of help them continue to work together as they struggle through this, with all the ups and downs and whose fault is it. But you just told the mom separately, wow, look what a great job she's doing. And even to do it the other way around, look at that, your mom is here helping you out, so just those softer things that are so much part of our lifestyle, and just to help them keep going, because this is a tough one. It's really, really a tough one.
And tell them to watch a baby learning to walk.
Yes,
Because they fall down a lot, but they don't stay down.
Yep.
Very nice. Wow. Well, this was certainly educational for me. I always learn so much at these, and I'd like to thank our regular panelists, Dr. Carrie Graff and Dr. Mira Agrawal, and our special guest panelist, Dr. Milton Mills. and our presenter who did so much work tonight, Dr. Kim Scheuer, and Dr. Susan Friedman, who is always in the background helping us wrangle our cases. And to all of you who joined us from all over the planet tonight. It's all I can do to not cry. So I'm going to end this now. And hope to see you next month at our next Lifestyle Medicine Grand Round. So peace to all of you. Have a good night.
Good
Good
night.
night.
Thank you, Ted.
Thank you, guys. I really appreciate
Hanging
everyone's
together.
help.
Bye-bye.
Good night.
All
Nice
right,
job, Kim.
bye.
Thanks, Ted.
Absolutely.